It's Friday,
doing this?
and it is the World Hand Hygiene Day, I would like to say. Obviously, on this day, there were some very staggering statistics, and that is why we need to observe this day. So, only half of the health centers have hand washing facilities, that too according to the UN, and 53% of the schools in the developing countries have basic hand washing facilities, which is also a very staggering amount, because obviously in our religion, safai nisf mana, right? Or hygiene is half of our faith, and obviously there is a huge urban-rural disparity when it comes to hand hygiene. So how much important it is, what we need to do to develop such sort of hygiene, and that's very cost-effective manner, right? This is something that we can wash with a soap, right? Or if you do not have the soap available, what can be done in order to avert all of those germs that can attack us through the outside.
Exactly, and Haja, in addition to that, when we say that it's cost effective, there's multiple facet approach to it, and that is that imagine, so people, when they're going to wash their hands, they're not going to fall ill, right?
That's true.
So imagine there will be lesser cost on to the healthcare sector as well, and that's where we say that that we're going to save a lot of cost. But ladies and gentlemen, this year the theme happens to be accelerate action together, save lives, clean your hands, and believe me, just by washing your hands, ladies and gentlemen, मैं ये बाद में उर्दू में भी कहूँगा, just by washing your hands, you are saving yourself from a lot of illnesses and diseases. Once again, ख़वातीन और हज़रात, आज आलमी दिन है हाथ धोने का, और हाथ धोने से आप काफ़ी कॉस्ट बचाते हैं. वो किस तरह से कि आप खुद बीमार नहीं होते, तो एक तो सबसे पहले ये कॉस्ट बचती है, और फिर जो इतना बड़ा मजमा खुदा न ख्वास्ता अगर बीमार हो जाते हैं, मेरे ख्याल कोविड में भी हमें हाथ धोना ही सिखाया कि किस तरह से हाथों को एक्चुअली हमने धोना है. तो प्लीज मेक श्योर दैट यू डू दैट एंड टू डिस्कस अबाउट इट कि हाउ do we actually save ourselves from so many illnesses and diseases. Ladies and gentlemen, we're very lucky that we've been joined by somebody who happens to be a consultant in internal medicine. Ladies and gentlemen, he is Dr. Imtiaz Alam Afridi. Assalamu alaikum. Good morning. Yeah, go ahead. Let's do it. I wanted to say something in Pashto. Assalamu alaikum, sir. How are you doing?
Wa alaikum assalam. Good morning to you. Thank you very much for having me on your show. And I'm glad that you give me the opportunity to talk about a very important topic, yet very simple, as you explained and as you said in your prelude. And you said already a lot about the hand washing, and you give very nice statistics about it. So it's a very important message that we want to convey to the public, and it's important for many reasons. As you said, it saves life, as the theme of the World Hygiene Day today is. It saves lives. Clean your hands. It's a simple, the most simple step and the most cost effective and most effective one to prevent the spread of infections.
And for us to, sir, make it understand to the people out there, because we have this greater responsibility on our shoulders if we go out in 47 different countries, how can you explain that what is the effectiveness and the impact of your hygiene and clean hands? Obviously we do know as Muslims, that's half of our religion. Safai nisf man hai. But how effective is it, and what sort of illnesses and diseases do we protect ourselves by just washing our hands? That's it. Bismillah.
Okay, so just to give you a little, diseases are two types if you put it into two: communicable and non-communicable. So non-communicables are like your blood pressure, hypertension, and diabetes. You cannot give it to other people by touching with that. The communicable disease, on the other hand, is when you come in contact.
COVID.
Absolutely, it's called viral infections, cold, flu. COVID was the recent one, the whole world have seen it. Diarrheal diseases, norovirus, which kills millions of people and especially children across the world. In fact, in Pakistan, among the 15 developing countries, we are on the 5th rank. 73% of the kids under the age of 5, they fall ill to the diarrheal illness, and majority of them will die. So this is a very poor, very sorrow sort of state as we look at the statistics. And this is a simple step that hand washing can prevent this. So, and we all know about it, but unfortunately it's not as practiced as we should do. It's inverse even with the healthcare. That's the most focus of this Hand Hygiene Day.
Exactly, and which is why, sir, we gather over here to kind of raise the importance on this as well. And I'm glad, alhamdulillah, that we get this opportunity over here at PTV World. But for Pakistani market, I think that at times that there should be a program in Urdu too as well, the kind of topics we discuss. Now imagine that we go to get chapati, right? We do not know whether the tandoor guy has washed his hands. Imagine we go to a physiotherapist or a doctor, we certainly do not know whether they have washed their hands. Doctors obviously are very careful about it. But, and since it's a part of their routine, so we do see that, they're wearing gloves and whatnot.
Yes.
So imagine we go to a mathai wala, we go to somebody else, we go to our barber, there's so many places. And then there's one more thing which is more social and cultural, and it puts pressure on you as well. So imagine that that the other person you're about to shake your hand with is actually cleaning somewhere, or is a staff which actually helps you every single day. But I think my character does not allow me to not shake hands. So I have to, and I'll have to wash hands afterwards as well. How do you think people can correct these mechanisms where it's justified that, okay, since you are at your work and I think that you might not have washed your hands, it's not a good idea to shake hands. So just say Assalamu alaikum.
Yeah, I think shaking hands is just mere culturally, it's not religiously. Religiously, what we say is Assalamu alaikum.
Yeah.
Yes.
And COVID have shown us that it did demonstrate. And we practice it. We start doing this, putting your hand on your heart like this, say, this is another gesture of it, as good as shaking hands.
So,
yeah, that's a kind of thing. I think they stopped doing that as well. It's a cultural thing, very difficult to, it will take some time to change the people, the cultural norms. But I think the more we educate people, the more the understanding about that will help us in the long term. Yeah, shaking hands definitely is the biggest source of it, because you don't know somebody sneezed it and just wipe his nose with a hand or something, and you just, so that's, there you got cold, flu and all the viruses is there.
That's true.
So yeah, that's a very important thing. And of course, as you mentioned about the 80% of the diarrheal disease is because of the foodborne disease.
True.
And majority of them is because of the touch. It's transmitted to others by the touch. So this is how it is happen. And we all have seen it. If we eat outside, the standard of hygiene, invariably, most of the time, I end up having some tummy problem.
Right, but Dr. Saab, we've seen, especially in the very vulnerable communities or marginal communities, especially the kids who are scavenging through all of this waste or dustbin, or they're picking up that waste and all of that raddi ka mal from the dustbin. How vulnerable those kids are to such sort of bacteria which is festering in all of those dirt. And yes, our religion preaches us to practice the hygiene, but unfortunately we have forgotten to incorporate that habits into our cultural or social modes, right? So number one, how vulnerable they are, what can be done to avert all of that vulnerability, and how can we educate them in the first place that you need to wash your hands and you need to be more clean, because obviously they are dealing with the bacteria and all of that, the dust or whatever you call it.
People feel offended when you tell them, hey, you know what, please can you just wash your hands before handing me the towel or something else, or a chapati. And it gets just difficult for you.
That's true.
Yeah, no, I know this is it's all about education and awareness. The more people get aware and educate about it, then it will change it. But we will, nonetheless, this is what the theme of the World Hygiene, the action together. So we need to accelerate the action together. So the societies has to come, the civil societies, all the health organizations, they all to come together to send out this message. And especially for the healthcare workers, and as you said, for those marginalized boys, we can do some public display of information as you need to wash your hands. So more information. We can put out some gels, alcohol gels out there, so they can even at least wipe their hands with that if they cannot wash in water. Availability of soap and water, which is you would be surprised, 2.3 billion people in the world, they don't have an access to water and soap.
Yes, yes.
So that's a very staggering statistics to look at that. So availability of that, awareness, education, that will help to, as you said, those, especially those marginalized ones.
Right.
And if we could do this, then we'll be able to.
Since we are talking about those marginalized communities as well, and how they might not even have access to clean drinking waters,
Absolutely.
so it's really hard for them to kind of clean their hands as well.
Hands,
But there's this other mindset over here. There's another side to the picture, and that is, yaar, iski immunity dekho kitni set hai. All of that. Yeah, I don't know, because it's not research based, and it's not a part of our database where we could actually kind of figure out, God forbid, what sort of illnesses they're going through. And how majority of the people I see on the roads who come across, they've been telling me that they unfortunately have HIV as well, and you know, such sort of
That's true.
other illnesses. But imagine, do you think that this phenomena is correct, that you know, that you really need to be hard on it, you know, it's perfectly all right if you do not get water, just eat it the way you get it, you know, things like that?
I usually say to these people, it's not just about you, it's about others.
True.
Your hands can be a killer, your hand can be a saver.
True.
So you may say you're young and strong, your immunity is good. But what about the children,
Yes.
the young ones whose immunities are not the extreme of the ages, the elderly people with the
True.
chronic diseases, with the transplant, cancer, all these people, they are very vulnerable. So if you get the germs, it may not affect you. Your immunity may be strong as you perceive or you think about
Yes,
it.
yes.
And most of it is right. Yeah, your body will be able to fight it. Common infections, they usually do. But what about if it's you pass it on to your elderly,
That's what
loved
happened
out
in
at
COVID
homes,
too. Yes, yes.
and they are vulnerable? They can easily get infection. Simple flu, they can get pneumonia, and elderly can easily take them down and
True, true, true.
kill them.
Unfortunately.
People are killed. Diarrhea, dysentery, cholera. How does it spread? The same way. So it's this about is my immunity is strong. I need to worry
No.
about it. That's the thing is I usually that's what I'm saying to you. Your hands is can be a saver or a killer. So you want to be a killer or want to be a saver?
Exactly, and we certainly do not want people to be ignorant of this
Yes,
fact as
yes.
well. And imagine that, you know, I think during COVID, this is something that we all learned, that, you know, that we really need to keep ourselves away from our elderly as well.
Yes.
You know, because God forbid, you know, if it's because of you that they have been infected with the bacteria,
Yes.
and unfortunately, if they're no more in this world, you know,
Yes.
you cannot forgive yourself. And this is not
Yes.
something, and it just happened because of you being careless. That's one
Yes.
thing. But now, sir, let's come down to, you know, people who are healthcare providers. You know, obviously, when you go to a private hospital or a public hospital, there is this trend. You do see a lot of doctors sanitizing and whatnot, and it's great. But at times, you know, when you know, you do not have an eye on them, they certainly might even miss it. Because I happen to have a
Yes.
wonderful nephew. He's a dentist back in the UK, and he used to tell me that I have seen a lot of students who might not even sterilize their equipment
Yes,
and
yes.
then use the same one in somebody else's mouth, which can cause hepatitis,
God.
can cause any other sort of illnesses as well. How do you think that the healthcare system really needs to devise a mechanism with which they know that everybody who's out there attending a patient has got clean hands?
Absolutely. I think this is what the theme of is it
Yes.
working all together. And I think the main focus was on the healthcare.
Yes.
So it's your right and it's a respect to have a clean environment at the point of care. This is what the WHO says.
Yes.
And this is what we are aiming to achieve that. Unfortunately, as you said in your statistics,
Yes.
we are very short of that mark.
That's true.
It's a long way to go. We need to improve on that one. I don't know, it's by human nature. We don't like washing hands. But it's something that's very, very important. As you said, I mean, using non-sterilized or
Yes.
equipment, that's
Yes.
criminal, that's
True.
negligence,
Yes.
that cannot be justified or anything.
Right.
But it's very, very important. A lot of the health facilities, unfortunately, don't have the proper facilities for, as we say, the water and soap facilities,
Yes.
washing.
Yes.
It has to be available, readily available in almost in every clinic. There should be one there.
Right.
There should be hand sanitizers.
Right.
There will be displays on their walls about the education.
Yep.
Right.
Even in a Western, like a UK country,
Right.
there was an infection control team.
Right.
They actually enforced us.
Right.
They were like us, like spies. Yes, yeah, they were hounding us, and they were just like, you know, we were very scared of watching them.
Yeah,
That infection control team,
and then
they will come and
I
then
think
check.
we developed
Have you done
really,
this? So yes, you have to
Yes.
put some sort of informant,
Force,
some
yeah.
checks on that.
Yeah.
Right. So, Dr. Saab, I was going through Shahzad actually very, research which was very eye-opening, and that too on the news, which said that we have developed this new habit. You know, mostly people take their mobiles to the washroom, and it says that that's very dangerous because that by bacteria it manifests on your mobile screen, and it's very hard to kill, and that is also transmitted through your hands, right? Of course. So, as a doctor, what sort of changes do you recommend? Do you feel that's very dangerous taking your mobile to your washroom, because obviously we are so glued and hooked to our mobile all the time
So
that
बगैर दिल ही नहीं लगता.
exactly even to a very space
That's
like
true.
washroom.
I mean, we are all guilty of that, and
Yeah.
we know that.
Yes.
That's a common observation. We all do that. But yeah, it's true. I mean, this is what we come out. But again, it's if you're washing your hands, the 5-7 times in the day you have to like wash your hands. That's before preparing the food, before eating the food, after eating the food, having your meal, coming out of the toilet. This is the must things.
Yes, yes, of
So
course.
you have to wash your hands there.
And mobile also?
Mobile, you cannot wash it.
You have Dettol wipes for that.
Yeah,
Yes.
Dettol wipes, not Dettol wipes, it has to be alcohol wipes.
Okay.
Remember the germs, a lot of the antiseptics or the disinfectants, they are not, it has to be at least 60% of the alcohol
Okay, okay.
to kill the germs.
Okay.
Which means that my father has been really smart, because I see him every night, cleaning his food with the
Wonderful.
alcohol wipes as well.
Yeah.
And it's wonderful. Thank you so much for educating. And
Thank
I
you
saw
so
it
much.
in Japan somewhere that, alongside where you wash your hands,
Okay.
they have fawn sanitizers for you. You put them in,
wonderful.
and there's a ray system,
Yeah.
and they're clean. But very quickly, sir, towards the end, one last thing, and that is that while I was growing up, so one of my sister had the OCD, obsessive compulsive disorder. And even I had it. I was guilty of it. So imagine,
Sure.
if I'm going to touch the soap, I'm going to clean my hands again. If I touch the door, I'm going to clean my hands again. So every now and then I'll close the door of the washroom with my elbow. And life was difficult for me. For people who have this OCD, how can you comfort us? What will you say today that, okay, once you wash your hands, they're clean. You do not have to wash them again.
It's very difficult to tell the OCD person. That's a very psychological thing. So they need help from psychologists and from psychiatrists. For normal people, I would say, if you wash your hands,
Yes.
that's a 20-second rule.
Okay.
Yeah, so you have to wash it with the soap and do it for 20 seconds, because
Right.
it's been shown if you do for at least 15-20 seconds,
Right.
then the chances of you cleaning the germs more than 90%.
Right.
Wow.
And if you do for another 15%, you're almost going to 99%.
Wow, that's
if you
wonderful.
do it properly.
And for everybody who's out there, I think I'm going to show you first how I wash my hands, and I'm going to ask Dr. Saab over here whether is this the correct way of doing so. So obviously first you're going to put up soap, then obviously I rub like this, so I'm sharing how I do it, and then like this,
Okay.
and then like this, and then like this, and then like this over here and over here, and it actually kind of takes somewhat 10 or 15 seconds, and then just make sure everything's clean, and that's it.
I think
Bismillah.
he's that
Is that correct?
Bablu
Absolutely.
from that ad.
Absolutely, you've done almost all the steps. There are five steps that we do.
Yeah.
And the time, actually, if you cannot put a watch or clock there for 20 seconds,
Yeah.
they say you can say the happy birthday,
Yeah.
the whole rhyme or something they sing along with that. When you finish, by then it's almost 15 to 20
Right.
seconds.
Exactly.
So that's why just say happy birthday to
So
me.
it's never.
And 5 steps,
Yeah.
if I just explain,
Please go
you've
ahead,
done it
go
all.
ahead.
See? So front of the hand,
Yeah.
your palm,
Right.
Yeah.
After that, back of the hand,
Yeah.
you've done that. Cupping of the fingers,
Okay.
like this.
Yeah.
Right.
Yep. Your palm,
Yeah.
Right.
and then your thumb.
Yeah. That's it.
That's it.
Thank you so much,
So
Dr.
these are
Saab,
the
because
I
this
think you
means
need
that
to add
sabun
some
slow nahi hai, aapne 20 second haath dhone hain.
And there's one thing again, simple soap and water is the best. There's bacterial soaps,
Yeah.
the antibacterial soaps.
Right.
And FDA in 2016 banned a lot of those soaps because of they are not any better than providing you the hygiene, but they will have other ingredients will be harmful for you. So
Alright.
simple soap and water, that's more than enough. And if you
So
do
no
it for
hygiene.
20 seconds proper, that's it.
So no fancy soaps,
No fancy soaps.
Okay.
amazing moisturizing soaps and whatnot. Just a
I-
sabun, ladies and
I
gentlemen,
just
and your
use
hands and
just
water.
a sabun, so I think we need to incorporate also the Islamic teachings into our life, which is unfortunately vanishing away. But thank you so much, Dr. Saab, for coming here and for enlightening us on this World Hand Hygiene Day about the importance of hand hygiene, and you can avoid a lot of catastrophic healthcare diseases in your life, but just mere washing your hands, right?